Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today in the show, we have Jennifer Reid. She is a psychiatrist, and her Kevin MD article, which we'll talk about today, is titled, "We Need a Mental Health Infrastructure Bill." Jennifer, welcome to the show.
Thank you so much for having me, Kevin. It's a pleasure to be here.
We'll get into the article in a little bit. First off, briefly share your story and journey to where you are today.
Sure. Yeah. So I grew up in rural North Dakota in a really small town there, and my father was a physician, and my maternal grandfather was a physician. So really, it's in the blood over the years. I've always wanted to do medicine and started in internal medicine, but then realized that psychiatry and the patient's narrative, their story was more intriguing to me. So I switched over, and now I'm affiliated with the University of Pennsylvania. I worked there for a number of years, and now I'm in private practice, but also trying to do some of my own podcasting and writing and some of those things these days.
So tell us about some of the typical cases that you see in private practice psychiatry. What's a typical day like for you?
With the transition with COVID, I'm primarily based from my home office, which is what you see here. I have an office in Philadelphia, but primarily I'm home. And I see a lot of working professionals, actually. I see a lot of physicians, attorneys, people that are out trying to contribute to the world and are struggling with things like anxiety and insomnia. Those are primarily some two areas that I work on. And then I also treat people with something called interpersonal therapy. So those that are having a lot of relationship conflict or have gone through a huge transition or grief and loss. So I do some writing about that as well. And so those are my prime folk areas. And like I said, I see a lot of people who are out there working and just trying to overcome some of those challenges.
There's a pretty big shortage when it comes to behavioral health specialists. So we have a lot of health professionals in training listening to this podcast. What are some of the rewards and what are some of the reasons that they should go into behavioral health?
I love that question. Okay, yes, absolutely. We need more people to enter into it. And I think it is increasingly more popular and a more competitive specialty to choose. I do think that the life balance, the work life balance is more readily obtainable. My sister's a surgeon as well as my husband, and I see how many hours they need to put in, and they certainly can't work from home in their sweatpants on some days. So I think there is a nice work life balance. But as far as just the interest in the area, the growing field of neuroscience, some of the epigenetics involved in kind of the intergenerational transmission of trauma and some of the challenges we face there. Certainly, our treatments are improving, but I just think it's such a fascinating and growing area. Neuroscience certainly is just very high in the list of things that we're doing some of the most interesting research in. I really love the way that I can see and help people over time and really not
Mhm.
only help an illness, but just help their entire being. You really see them, especially coming out of depression or severe anxiety, coming to life again in a way that I just didn't see in any other specialty. Obviously, I'm prone to mine, but I do think it's one of the most exciting specialties that people can work in, and you really can help and do a variety of things. Look, I get to see patients, write, do a podcast, contribute to different things. So a lot of teaching. It's a nice way to have variety as well.
All right. So let's jump right into your Kevin MD article. This was published last year. It's titled, "We Need a Mental Health Infrastructure Bill." Now, for those who did get a chance to read your article, just walk my audience through it. Share the story, why you decided to write it.
Yeah, I think that it was really thinking about, certainly during the pandemic, as you were hearing in general media about the shortage of providers and increasing rates of anxiety and depression and insomnia among all ages, particularly our youth, but all ages. And it just got me thinking about how do we reach a broader set of individuals with evidence-based, high quality information about behavioral health? Because I think there's also this growing movement for wellness in general that isn't necessarily based on evidence-based treatments. And so I was thinking, how do we find different ways to reach more individuals with some of these treatments? Because I see how much they can be beneficial. I see how even a conversation with someone maybe who comes in to see me with panic disorder, just explaining what's happening physiologically makes a huge difference for them. And they may have been coping with this for years and years. So the idea was, how do we spread this information? What are the challenges that we're facing as these numbers continue to diverge, number of providers versus need? And also, what are the different ways we can increase the number of providers? And why is that so important? Not only inherently important for mental health treatment and for people to be mentally well, but also even just economically and financially, right? You think about depression, you think about the lost days of work and some of the more disability associated with that. You think about our overall GDP of many of our citizens are struggling with mental health issues that are undertreated or untreated. And that just can cause a massive challenge economically as well. So just thinking about the different structural pieces in place that limit the number of providers, that make it difficult to reach them, certainly in certain areas like rural North Dakota, where I grew up, but also just thinking about how can this affect things more broadly. And so we can get buy-in from leadership that, look, we need to make some changes here.
So let's go into more detail in terms of the limitations that you mentioned. So you said that there's a lot of limitations on the number of behavioral health specialists that are out there. So talk more about that.
Yeah, I think we are dependent within psychiatry on the training programs and the openings for resident positions. And that it is costly. And each program is trying to weigh the costs of adding their own resident slots in if they need to, but really trying to get federal support for these increasing numbers of residents that are coming in. I think another challenge, though, is just generationally, many of the psychiatrists that are out there practicing are in their 50s, 60s, 70s. So what's looming is a mass retirement of a number of different providers there. And I think, how do we encourage, as you asked me to speak to at the very beginning, how do we encourage our young providers or those in training to go into psychiatry? I think another challenge is just there is the law for mental health parity and insurance coverage, but honestly, the reimbursement rates at this point make it very difficult to sustain practices without really scrunching a lot of patients into a short period of time and lowering quality of care potentially. So I think that's another area where, or if someone's coming in, they want to go into psychiatry, they want to have their own practice, they have a huge number of loans coming out of medical school and undergraduate, for example. It's very hard to choose and thrive and be able to pay those things off if you're accepting insurance. So then that really decreases the access for so many patients that need to use, understandably, their insurance coverage for mental health treatment. So these are some little kind of pockets of things that can be really big problems that I'm seeing over the next number of years. And the last one I would just touch on is burnout, physician burnout. One of my colleagues, Richard Summers, they published a paper that really looked at who was struggling most with burnout of psychiatrists within our specific field. And it seemed like those that were younger in training, women and minority trainees, are having more difficulty with burnout. So that's also worrisome because we really want to try and increase both gender and just other diversity within our trainees and future providers.
One of the things that you mentioned earlier was evidence-based psychiatric therapy. So are you seeing behavioral health treatments that aren't evidence-based? How big of an issue is this?
I think that there's just a lot of misinformation out there in that people who may not have a background or training in some of the specific diagnostic criteria or treatments that really have been studied are out there describing things like supplements or things like, nutritional psychiatry is its own growing field, but I think in isolation, say you can just eat these certain foods or really optimize your microbiome and then you don't need to be on medication. I think some of that misinformation is worrisome. And I think that there's things that are portrayed in the media, like a big paper recently that sort of the neurotransmitter theory around depression was a little bit debunked, that it's not a decrease or an abnormality in the amount of neurotransmitters like serotonin you have. But that was oversimplifying diagnosis or ideas of etiology of depression in the first place. So I don't want that to make people out there who don't really know how to interpret that think, oh, I should just stop my medication. They don't really help anyway. So I think that's where I'm struggling a bit, is with some of the different pressures that are out there for patients who are trying to navigate a complicated system, and their family members for that matter. And they don't necessarily know, how do I parse out some of this disinformation I'm hearing? And maybe they don't have access to a trained mental health provider who can help them debunk some of these myths around their symptoms.
Now, if you were the architect of a mental health infrastructure bill, what would be the specific components that you would definitely want included?
Great question. So I think one thing we really need to try to optimize is having realistic reimbursement rates for care so that we can really increase the number of providers who can truly sustain a practice that's insurance based. Because of course, patients want to use their insurance to cover their mental health treatment. And so a lot of them are really boxed out. How do we increase the number of providers? I think we do need to increase residency slots. I think that there are certainly an increase in nurse practitioners, in physician's assistants, and others that are stepping in to help in this way. I think perhaps a little bit more structure in place for psychiatrists to really work at the top of their license and maybe even oversee some of these other providers like they very much do in some of the other specialties. How do we find a way that a psychiatrist could maybe consult across different areas? So the idea of building into structure, and this is increasingly happening in different academic centers around the country, of psychiatrists embedded in other health practices. So I was embedded in the family medicine department at Penn for a number of years and was able to then help them with their different medication choices so they didn't have to as quickly refer out to mental health, or maybe they were able to manage the meds themselves with increased confidence because I was saying, yes, you can start lithium. Let me just help you get started. Here are some of the tricks and challenges that we can try and address. So I think some of those areas are certainly where I see that. And with social media, boy, that's a much bigger issue,
Mhm.
right? And how do we protect our kids? I know there was a bill that was being worked through in keeping our kids safe from a social media perspective and some of the different limitations we can place in those areas. That's a much broader topic, but I do think that we're going to need to address some of the information that they are receiving. And some of it's pretty scary on social media and other online avenues.
We're talking to Jennifer Reid. She is a psychiatrist, and her Kevin MD article is titled, "We Need a Mental Health Infrastructure Bill." Jennifer, as you're a primary care physician, and sometimes, like you said, we just don't have access to behavioral health specialists in pretty much a lot of areas in the country. What are some specific things that I can do as a primary care physician to improve my behavioral health treatments? What are some high yield things that primary care physicians can do?
One thing, and a couple things that I really focus on, I certainly could recommend, and that would be really targeting anxiety and targeting sleep. Let's start with sleep. I think that, first of all, primary care providers, like I said, my father and grandfather were both primary care, and I so admire how quickly you can go through all these different body systems in your 20-minute visit or whatever it
Mhm.
may be. So I recognize there's not that much time to, for example, if someone comes in with a sleep complaint, to really go through a full sleep assessment. I may have the luxury of that time in my longer assessments. But I think recognizing some of the pros and cons of medication for sleep and knowing that ideally they'd be used, right away and for a short period of time, but having some other recommendations, other avenues, looking into the idea of CBT for insomnia. I honestly think every primary care provider should do just a training course in that, maybe a day or two. It doesn't take long. There's some great providers that I work with at Penn that do this teaching. And I think just having some of those basic tenets of here's some simple things that I want you to try and do to help with your sleep. Because we know that sleep deprivation and even insomnia increase rates of other mental health issues, increase relapse rates of mental health issues, and can also increase rates of many other general health issues. So metabolic issues that people have, it can lower your immune system, it can increase inflammation if you're not getting adequate sleep. So that's one area that I think could be really high yield is what are some just basic tips that you can give patients that reverse what so many of them do when they start having trouble sleeping, like staying in bed a lot longer or doing multiple different things in bed, or some of the things that people inherently try to do to sleep better. Use alcohol, which is self-defeating for sleep. So I think that could be really important. And also just the basic physiology of panic disorder, just being able to explain to a patient what's happening in your body, that this is absolutely normal. It's just triggered at the wrong time. And it doesn't mean that there's anything going wrong. People come in and say, I must be going crazy. I'm having these panic attacks. And I'm like, look, we just have a really sensitive signal. How do we explain what that is? And how do we find ways to start re-exposing yourself to things you maybe were previously avoiding? Because avoidance is going to lead to more anxiety. So those are like two kind of key things, and some of the things that I try to talk about on my podcast or interview people about on my podcast to see if I can get that information out there. And podcasts are free, right? This is a
Mhm.
great modality to spread it even around the world. So I think that that can be really helpful too, is to listen to some of those different podcasts that are out there.
So you've made a transition as a physician into the social media podcasting world to really elevate your platform, elevate your voice so you could share your message outside of the exam room. So give me an example of how that moved the needle to spread your message.
Certainly. And I think that the podcast, having thousands of listeners that are listening to different interviews with people who maybe are working in academia. I had a lovely interview with a woman at Columbia who does cannabis research, just talked about what truly is known about cannabis, what sort of studies have actually been done, and how much of what we're being told in the different dispensaries or different medical marijuana clinics are truly those that have been studied in a scientifically rigorous way. And so in that way, just getting that information out there, but it was a conversation. I'm not a very formal person, so it was just a casual chat. And I think that way of absorbing information, it's good for me to do it that way. And I think many people appreciate that would never pull out her journal article and go through and read it or understand the statistics. So I think in that way, I think me with the podcast, talking about insomnia, doing one specifically about anxiety, sharing the things I share with patients every single day as a way to try and reach more people that I simply can't see one-on-one in my office. And then I also think the writing, another article I had submitted to your site, which I think is terrific, by the way, to elevate
Thank you.
physicians' voices. And it's so helpful and so nice. I love to read it myself, but about physician mental health. And so I think that writing about that helps me to process some of my feelings about that and help understand. And I can also send it to individuals who are having some similar challenges and say, let's see if this resonates with you, or let's see if you have any comments on this. So it's just broadens the access and I think the availability and also the egalitarian aspect of podcasting and writing where people can access this information for free feels really good too, because then I think maybe I'm being a part of that solution to a provider shortage.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
So one thing I always say is that I think your mind should be on your side. And I think that's what I run into with a lot of people struggling with anxiety, with insomnia, with self-confidence issues. Certainly people in healthcare, physicians who are really feeling such a sense of responsibility, even for things that are broadly beyond their control. So when you're starting to battle with your own mind, that can really make it difficult for you to be out front doing your best work. So I think about these different ways of helping to share tips on anxiety, tips on sleep, as making a healthier population that's going out and solving some of these huge problems that I can't solve myself, but that I worry about or I worry about for my kids or next generations. So I think trying to get your own mind on your side can be such a powerful change, whether it's coaching, whether it's therapy, whatever it may be. I really encourage people to check it out.
Jennifer, thank you so much for sharing your time and insight. Thanks again for being on the show.
My pleasure. Thanks for having me.